Hey everyone, welcome back. Today's explainer is tackling something that is just incredibly frustrating and honestly widely misunderstood: burning feet and diabetes. If you or maybe someone you love are losing sleep over this, you are in the exact right place. We're drawing today's insights entirely from a really fantastic patient education masterclass. It was put together by Dr. Praveen Ramachandra, a senior endocrinologist at the Diaplus Endocrinology Clinic over in Nulahanka, Bangalore, India. He's laid out a super practical framework for managing diabetic neuropathy. And together, we're going to explore exactly how to protect those feet and, get your comfort back. Okay, let's dive right into this. Here is our roadmap for today. 1. Understanding the burning sensation. 2. Your daily foot defense. 3. Smart footwear and walking. 4. Easing the nighttime burn. 5. Lifestyle changes that heal. And finally, 6. Red flags for urgent care. Starting off with Section 1, understanding the burning sensation. So to stop that awful electric shock pain that's keeping you awake, we first need to understand what's actually happening biologically. And to do that, let's shatter a highly dangerous illusion right out of the gate. A really common myth is that if your feet are burning or tingling, well, it must mean your blood is flowing beautifully and kind of waking up the area. Actually, the reality is the exact opposite. That burning sensation, it's a distress signal from damaged nerves. In fact, a lot of patients suffering from this have both neuropathy and poor circulation, which heavily increases the risk of developing non-healing ulcers or even facing amputation. It's a structural warning sign, definitely not a sign of healthy blood flow. Medically speaking, this whole thing is called diabetic peripheral neuropathy. It happens when long-standing diabetes literally damages the nerve fibers down in your extremities. But here is the really cruel irony of this condition. While it causes this intense burning pain on the inside, it simultaneously reduces your ability to feel normal pain, heat, or pressure on the outside. It makes your feet what doctors call insensate, which basically means you could step on a nail, walk on a scorching hot pavement, or get a massive blister and dangerously injure your feet without feeling a single thing. Crazy, right? Moving right along to Section 2, your daily foot defense. Because of this invisible threat we just talked about, your day-to-day self-care isn't just a suggestion. It is absolutely your best, non-negotiable defense against complications. It comes down to 4 simple steps every morning. Step 1. Wash your feet daily with lukewarm water and a mild soap. But, and listen closely to this critical warning from Dr. Ramachandra's clinic, you must test the water temperature with your elbow or have a family member check it. Because your feet are neuropathic, they just can't feel extreme heat accurately. You could step into scalding water and get terrible burns without even realizing it. Step 2. Dry them thoroughly, especially between the toes, to prevent fungal infections. Step 3. Apply your moisturizer or oil, but only to the tops and soles of your feet, never between the toes, where trapped moisture causes the skin to break down. And step 4, always cut your nails straight across, not too short, and absolutely zero DIY bathroom surgery on corns or calluses, okay? All right, Section 3, smart footwear and walking. Since your feet might not feel minor cuts or pressure, your shoes literally have to act as your physical armor. The medical guidance is super firm here. You must never walk barefoot. Not outdoors, and no, not even indoors. A tiny hidden pebble on your living room floor can cause a cut that spirals into a severe infection before you know it. You want to wear closed, comfortable shoes that have a nice wide toe box and a low heel. Go ahead and toss out those thin, unsupportive rubber chopples. And here's a pro tip. Before you slide your shoes on, always reach your hand inside to check for small stones, rough stitching, or, a stray nail. Finally, pair those shoes with soft, breathable cotton socks. Change them daily, and make sure they don't have tight elastics that cut off your circulation. Let's move to Section 4, easing the nighttime burn. Evening time is notoriously when this burning feet syndrome kicks into high gear, turning bedtime into a nightmare rather than a time to rest. When you are just desperate for relief at 2 a.m., knowing the difference between what helps and what harms is literally a lifesaver. Safe relief looks like a brief 5 to 10 minute soak in lukewarm water, maybe toss in a little salt, followed by careful drying. You can also elevate your legs on a pillow to bring down swelling, wear loose cotton socks to stop the bedsheets from rubbing your skin, or try a very gentle, light massage with oil on your calves and feet. But I urgently need to warn you against the dangerous stuff. Absolutely no hot water bags, no electric blankets, and do not point space heaters directly at your feet. Because of your reduced sensation, these can cause catastrophic third-degree burns while you sleep soundly. And ice-cold water? It's just as bad and can actually make nerve pain worse. We also really need to acknowledge the psychological toll here. Waking up night after night with electric shocks in your feet causes profound insomnia, low mood, and irritability.
And here's the kicker. That exhaustion and anxiety actually amplify your brain's perception of the pain. It's a completely vicious cycle. So try to keep a regular sleep schedule, skip the late evening coffee, and maybe try some relaxation techniques like deep breathing. If persistent sleep problems or depression are setting in, please discuss this with your endocrinologist. Psychological support really does have proven benefits for chronic pain syndromes.
Which brings us to Section 5, Lifestyle Changes That Heal. Managing neuropathy isn't just about what you put on your feet, right? It's about your overarching lifestyle habits that encourage long-term healing and actually slow down the nerve damage. Let's start with a hard truth straight from the source material. Quote, smoking significantly worsens circulation in the legs and feet and increases the risk of non-healing ulcers and amputation. Complete cessation is strongly recommended. End quote. Listen, if you have diabetic neuropathy, smoking is literally like pouring gasoline on a fire. Quitting is the absolute most powerful lifestyle change you can make today to save your feet. Beyond quitting smoking, here are some daily targets. Weight loss through dietary tweaks has actually been shown to improve neuropathy symptoms, especially for folks with type 2 diabetes and severe obesity. Try to lean into a diet rich in veggies, whole grains, and healthy plant-based fats or fish oils, which studies suggest really support nerve health. You've got to strictly moderate alcohol too, because excess booze directly worsens neuropathy and absolutely ruins your sleep. Now for exercise. Brisk walking and balanced exercises are fantastic for boosting circulation and nerve function. However, and this is a massive caveat, if you have an active ulcer, a wound, or bad pain when putting weight on your foot, you must strictly offload, meaning rest that foot, until a specialist checks it out. Now, if lifestyle changes aren't quite doing the trick on their own, there are some great scientifically backed non-drug therapies out there. Physiotherapy-guided balance training, TENS, which is transcutaneous electrical nerve stimulation, and even acupuncture have shown real benefits in taking the edge off neuropathic pain. It's actually pretty fascinating how combining an ancient practice like acupuncture with modern TENS therapy can trick your nervous system into finding relief. Just remember, these are safe add-ons. They absolutely do not replace standard medical care, proper footwear, or strict blood sugar control. And finally, Section 6, Red Flags for Urgent Care. So the crucial point here is knowing exactly where the line is between managing things at home and a full-blown medical emergency. Despite our best efforts, complications happen, and reacting fast is everything. These are your red flags for a same-day medical review. If you see a new blister, cut, crack, or ulcer, if you noticed any blackish discoloration, pus, or a bad smell, or if there's a sudden spike in burning, redness, or warmth, you need to see a doctor immediately. And remember the golden rule of insensate feet. You must seek care even if these symptoms are completely painless. Plus, if you develop a fever alongside these foot symptoms or suddenly have trouble walking, severe imbalance, or falls, treat it as an outright emergency. Well, we've covered a tremendous amount of ground today, but knowledge is only power if you act on it. Don't wait for the pain to become unbearable, and please don't wait until you find a painless wound. Take your shoes off tonight, really inspect your feet, implement these habits we learned from Dr. Ramachandra's clinic, and take control of your diabetic health. So I want to leave you with this to think about. Are you ignoring the silent warning signs your feet are sending you today? Thanks for focusing in with us, and keep learning.